Welcome to The Explainer. I'm so glad you're joining me today because, well, let's be honest. If you've spent literally any time online lately looking into weight loss, you've undoubtedly been bombarded with an overwhelming amount of information, hype, and just really confusing claims about GLP-1 medications. It's everywhere, right? But today we're doing something a bit different. We are cutting straight through all that noise. We're going to give you a plain language, totally honest look at the source material, detailing exactly what these medications are, how they actually function biologically, what the clinical trials show, and what the telehealth process actually entails. We're relying strictly on the data here to separate medical reality from internet fiction. Let's dive in. Right off the bat, we need to set the ground rules for our discussion today. This explainer is strictly for general education purposes only. It is not medical advice. I cannot stress this enough. Individual results with any treatment vary widely, and no specific outcome is ever guaranteed. Weight is deeply personal, and deciding to treat it is a strictly medical decision. Eligibility for any treatment is always determined solely by a licensed healthcare provider based on a really comprehensive evaluation of your own individual health profile. All right, here's our roadmap for today. Number 1, what are GLP-1s? Number 2, the biology of satiety. Number 3, clinical data. Number 4, brand versus compounded options. Number 5, safety and side effects. And finally, number 6, the telehealth path. Okay, let's jump right into section 1. What exactly are GLP-1 medications? So to really understand these medications, we have to look at human biology. GLP-1 stands for glucagon-like peptide 1. Both GLP-1 and another hormone called GIP fall into a category known as incretin hormones. Basically, these are hormones that your gut naturally releases right after you eat a meal. The medications you hear about all the time, they're simply designed to mimic those natural hormones. You'll generally hear two main names thrown around. First up is Semaglutide, which is a GLP-1 receptor agonist. That's the active ingredient found in brand name medications like Wegovy and Ozempic. Second is Tirzepatide, which is a dual GIP and GLP-1 receptor agonist, and that's the active ingredient in brands like Zepbound and Mounjaro. Both of these are administered as a once-weekly injection just under the skin. So what happens once they're in your system? Well, spoiler alert, they don't magically melt fat. What they do is alter the biological signals of hunger. First, they significantly increase satiety, meaning you feel satisfied sooner and you stay full longer. Second, they reduce appetite and what a lot of patients describe as food noise. You know, those constant, intrusive background thoughts about eating. Third, they slow gastric emptying, so food quite literally leaves your stomach at a slower pace. And finally, they help regulate blood sugar by supporting the body's natural insulin response. Keep in mind that Tirzepatide, which adds that extra GIP receptor activity, has actually been shown in preclinical research to potentially amplify these metabolic effects by decreasing food intake and increasing energy expenditure. The source material puts it perfectly. These are not just willpower and a pen. They fundamentally change the biology of hunger and fullness. Moving right along to section 2, clinical data and averages. Let's look at the actual objective data from the landmark trials, because it's undeniably stark. In the Step 1 trial, which was published in the New England Journal of Medicine, adults taking once-weekly semaglutide alongside lifestyle interventions lost a mean of about 14.9% of their body weight at 68 weeks. Now compare that to just 2.4% in the placebo group. Then, if we look at the SURMOUNT-1 trial for Tirzepatide, adults saw mean weight reductions of roughly 16% on a 5 mg dose, 21% on a 10 mg dose, and up to 22.5% on a 15 mg dose at 72 weeks. Again, that's compared to about 2.4% for the placebo group. The statistical gap between the medication groups and the placebo groups is absolutely massive. But, and this is a huge but, the crucial point you have to remember is that we are looking at trial averages here. They are absolutely not promises. Every single person's body is different and individual results vary widely. Furthermore, these clinical outcomes were achieved alongside dedicated lifestyle changes and under very strict medical supervision. No medical professional and certainly no telehealth platform can guarantee a specific number of pounds lost. The medication is just a tool, and it's meant to be used in conjunction with a much broader health strategy. Let's transition to section 3, brand versus compounded options. Let's take an impartial look at the marketplace reality. On the one side, you have brand name GLP-1 medications, like Wegovy and Zepbound. These are fully FDA approved for chronic weight management. That means they have been rigorously evaluated by the FDA for both safety and effectiveness for that specific use. On the other side, you have compounded semaglutide and Tirzepatide, which are prepared by compounding pharmacies. The honest, vital fact you absolutely must know is that compounded versions are not FDA approved. the FDA does not review compounded drugs for safety, effectiveness, or quality before they hit the market. If a provider prescribes a compounded option, you must be clearly informed of this lack of FDA approval so you fully understand the trade-offs involved. And the regulatory landscape here is shifting super fast. During the national shortages between 2022 and 2024, federal law gave compounding pharmacies broader latitude to prepare these medications. However, that has changed. The FDA officially declared the Tirzepatide shortage resolved in December 2024 and the Semaglutide shortage resolved in February 2025. Because of this, the enforcement grace periods that allowed pharmacies to compound what's called essentially a copy of these drugs ended in 2025. Now, compounded medications may still be legally permitted in very specific, narrow circumstances, like if a provider determines a patient needs a formulation that differs in a clinically meaningful way from the approved brand drug. But again, that is entirely a medical determination that has to be made by your provider. Next up is Section 4, Safety and Side Effects. We are absolutely not going to sugarcoat anything here. GLP-1 treatment is a process that requires a start low, go slow titration approach to help your body adjust. The most common side effects are gastrointestinal. We're talking nausea, which is often worse in the first 4 to 8 weeks, along with vomiting, diarrhea, constipation, indigestion, reflux, burping, and fatigue. Most of these are mild to moderate, and they are dose dependent. However, there are serious, though less common, risks you need to be aware of. These include pancreatitis, gallbladder problems, and severe dehydration caused by intense GI symptoms. It is vital to seek urgent care for severe and persistent vomiting, severe abdominal pain, signs of dehydration, or yellowing of your skin or eyes. Literally never try to just push through symptoms that feel severe. Because of these real risks, the intake process for these medications is absolutely not a guaranteed yes. It is a thorough, serious medical review. A licensed provider must evaluate factors like your BMI and any weight-related conditions. They have to look at your full medical history, specifically checking for personal or family histories of medullary thyroid carcinoma or multiple endocrine neoplasia syndrome type 2, as well as past pancreatitis or gallbladder disease. They also must review any other medications you take, any history of eating disorders, and whether you are pregnant, planning to become pregnant, or breastfeeding, because these medications are absolutely not appropriate in those cases. The goal here is always safety first. That brings us to Section 5, the telehealth path. So how does modern telehealth actually fit into all of this? Well, platforms like Orenwell are designed to connect patients with licensed U.S. providers in a highly secure online environment. The focus is on providing a professional, medically guided evaluation, maintaining strict medical oversight without just pushing a product. It removes the hurdles of traditional waiting rooms while keeping safety and rigorous intake protocols front and center. The actual operational path is highly structured. Step 1 is a comprehensive, secure online intake where you share your complete health history. Step 2 is the licensed provider review. Honestly, if it's not a good fit for you, they will tell you. Step 3, and this is critical, if a prescription is actually deemed appropriate, it is fulfilled exclusively by a licensed U.S. pharmacy. Step 4 is discreet delivery directly to your door, complete with guidance on storage and usage. And Step 5 is ongoing check-ins. Your provider may recommend baseline and follow-up lab work, and they need to track exactly how you're responding to monitor your safety and adjust the plan as necessary. One of the real benefits of this route is transparent pricing, which lets you know the cost before you commit. For example, the source material notes that through a platform like Orenwell, options for a 3-month plan of compounded semaglutide average about $99 a month. Of course, the final medication, the dose, and the pricing are ultimately determined by your licensed provider based entirely on your specific medical evaluation. And I will remind you one more time, just as the source strictly notes, compounded options, where offered, are not FDA approved. And that brings us to our final and honestly most important takeaway. We have explored the incretin hormones, the impressive but highly variable clinical trial data, the vital differences between FDA-approved brand names and non-approved compounded drugs, and the serious necessity of medical oversight for those side effects. But the only question that truly matters is whether this approach is safe and medically appropriate for you, specifically. Always, always consult a qualified, licensed healthcare provider to review your unique health situation. As science continues to untangle the deep biological roots of human metabolism, one really has to wonder, are we simply witnessing a new class of medications, or is this the beginning of a fundamental shift in how society views and treats weight itself? Thank you so much for joining me for this explainer, and keep learning.